There we go. All right. So what I'm going to do is a quick sum tutorial with you all. Today we are having a webinar style, and if we can go to the next slide, Sumiko, please. We are offering Spanish interpretation for those who need it. So all you have to do is go to the bottom of your screen, look at the glove, and essentially choose Spanish if that's what you are wanting to hear this in, or keep it off if that is if you don't need the interpretation. Para todos los que están el día de hoy aquí y necesitan interpretación, tiene que estar abajo de su computadora o de su teléfono. Van a mirar este icono que se mira como un punto, como un mundo, perdón, y solo tienen que seleccionar el idioma que quieren escuchar, por ejemplo, español o inglés. Y me está diciendo el intérprete que tienen que escoger algún lenguaje. And the interpreter is telling me that you'll have to choose a language to be able to listen either in English or Spanish. As we do today, as we hear today from our panelists, we will have a Q&A question, and I want to make sure that you all know where you can ask your questions, and it will be at the bottom in this box that is Q&A. Y para las personas que están también con nosotros, vamos a poder hacer preguntas en esta sección, que es una cajita que tiene la Q y la A. Okay, next slide, please. A couple reminders for you all. Make sure that your name matches the registration. This just allows to know who was here, and if you have questions or any follow-ups, we can follow up with you. Please use the Q&A box to ask those questions as we mentioned. And as a reminder, and I know I already said this, but this session will be recorded. Next slide. So today, our brief agenda, I'm going to share a little bit about who OHEA is. Not too much though, because a lot of us already know about OHEA. Then we will be talking about ballot measure 110 and HB 4002, a little bit of a background, as this is the second part to the series that we're in. And we will talk about the Oversight and Council Accountability panel. Very excited to have those folks here to talk to you about their experience and share with us some insight. And at the end, you will get to ask questions and hopefully get an answer. And if we don't have the time, don't worry, we'll follow up with you. We do want to make sure that we do a content warning. Today's event will cover topics related to drug and use and the history of drug policies, of course. Our aim today is to educate and inform, but we also understand that everyone comes with their own unique background and familiarity with the topics today. Please remember to prioritize your well-being and take care of yourself at any point during this event. And lastly, who is OHEA? OHEA is a People of Color-led collaborative organized to center and uplift the wisdom of our communities of color through racial justice, inform health equity policies and practices as part of the movement to dismantle white supremacy and shift the imbalance of power. We envision a world where people of color are able to lead fulfilling and healthy lives however they choose. And some of the bodies of work that we have are advocacy. We convene like today, we're here today with you all. And then also community engagement. And I'm going to kick it over to our host today, Sumiko. Thank you everybody for being here.
Thank you, Daisy. So we wanted to start off by providing some background on ballot measure 110 and House Bill 4002, especially for those who may not have been able to make our first event back in December, where our friends over at the Health Justice Recovery Alliance provided us some insight. So we're just gonna kind of do a recap on what they shared. So back in 2020, Oregon voters overwhelmingly approved ballot measure 110, making Oregon the first state in the US to decriminalize possession of all small amounts of drugs and greatly expand addiction services and social supports through redirected cannabis tax revenue and law enforcement savings. Before Measure 110, Oregon arrested people for drug possession while ranking nearly last in access to treatment. In response, voters approved Measure 110 as a needed intervention to the challenges Oregon was facing around the harms of arresting and jailing people for drugs, and to provide more services and support for people in need. In 2024, the Oregon legislature passed House Bill 4002 with bipartisan support. Some of the key features of HB 4002 include recriminalizing possession of small drug amounts as a misdemeanor and creating the Oregon Behavioral Health Deflection Program, which gave counties the option to establish deflection programs, allowing police to refer people to treatment instead of jail. Measure 110's Oversight and Accountability Council, whom we'll be hearing from today, was established as part of Measure 110 in 2020. It is made up of community members, many of whom have lived experience with substance use, recovery, or working in treatment services. The council operates under the Oregon Health Authority, but retains independent decision-making power related to grant funding. The Oversight and Accountability Council's responsibilities include overseeing the distribution of ballot measure 110 funding, which comes from cannabis tax revenues. These funds support behavioral health resource networks across Oregon, offering harm reduction, peer support, housing, and treatment services. They also ensure that funding decisions reflect the goals of health equity, cultural responsiveness, and support for underserved communities, while centering voices of people with lived experience in shaping Oregon's addiction recovery system. They also review and evaluate the effectiveness of funded programs, while offering recommendations for improving service delivery statewide. I apologize. I'm going to work on slowing down. I apologize. Before we introduce you to the panel members individually, we just wanted to give you a brief overview of who we will be hearing from today and the topics of their question. Today, we have Onisha Cochran-Dumas, whose question will be centered around community-based support. We also have Dharma Mirza, whose question is centered around harm reduction. Dr. Linda Ping, whose question is related to access to services. And Meredith Concepcion, whose question will be centered around prioritizing mental health services. Our first question is for Onisha, who is an Afro-Indigenous queer identified in long-term recovery from crack cocaine and alcohol. She received her AAS in alcohol and drug counseling from Portland Community College and her BSW from Portland State University. Onisha is an expert consultant for the Northwest Portland Area Indian Health Board regarding substance use disorder and peer support using ECHO curricula, as well as a peer trainer for the Metro Plus Association of Addiction Peer Professionals, and sits on the following boards and councils: Measure 110 Oversight and Accountability Council, the Oregon Food Bank Council, and the Certified Community Behavioral Health Clinic Steering Committee. Having spent 22 years in active addiction and 15 years in prison, she managed and designed several programs that benefit persons who have been released from prison and whom are fighting addiction, including her previous role as the senior director at the Miracles Club. She led the curriculum of the Diane Wade House, a 38-bed, female-identified, Afrocentric housing program for persons who were released from prison. It's been her life passion to make sure that her community has access to these resources. Thank you so much for being here, Onisha. Again, your question is centered around community-based support. Just for a little bit of background before we ask the question, we know that public suffering, such as visible homelessness, drug use, access to healthcare, and economic stability are challenges faced by urban, suburban, and rural communities. Measure 110 funds help people get off the streets with sober housing and extended periods for people going through treatment. As a peer mentor expert, could you speak to some of the changes in the community since ballot measure 110 and what you've seen since House Bill 4002 implementation last fall?
Yeah, and first, before I answer the question, I just want to say thank you to you guys for asking me to come and speak, especially you, Samiko. Um, yeah, so the number one thing about being on this council was to ensure that the population that this council formulated and planned together collectively to make to help support them was those most impacted by the war on drugs. So it wasn't just urban, suburban, and rural communities. It was those areas specifically identifying those impacted by the war on drugs. So you do see a lot of homelessness. You do see a lot of drug use. You do see limited access to health care. But how much of those people were impacted by the war on drugs? We're talking about a culturally specific earmarked fund that was supposed to go to those who were suffering and were victims of the war on drugs. And so a lot of people don't even know what the war on drugs is, but it was specifically when the FBI and the CIA brought crack cocaine to the Black community and started the epidemic that is still affecting many generations and our kids. So I just wanted to say that first and foremost. My question, can you go back to the slide where my question is at? Because this is some of the reflections that the public sees. And I think the public is misinformed as well, because a lot of people that they see on the streets are also suffering from mental health. And I know this specifically because my son suffers from schizophrenia and my sister as well. So, and it's not always about drugs. Can you go back to my question?
Um,
As a peer mentor expert, could you
yes.
speak? So some of the changes in the community, um, I don't think the community is looking at it on a macro level. I think they're like looking at it like, well, we specifically want to clean up the downtown area where the people are down there using fentanyl or shooting up on the park blocks because we want to bring money back to Portland. And it's not just about that. The Measure 110 money was funded for those impacted by the war on drugs. And I hate to keep repeating that, but I repeat it over and over because I feel like people don't really honor that. Like that's what the OAC Council specifically wanted it to be. So the changes in the community have been very specific, especially for the first fiscal years when I was on the OAC Council. I'm not on the OAC Council right now. I did serve my 4 year terms, but it's over now. But what the OAC, what we came collectively as a community and said was that we want this money to specifically go to those communities, poor white people, and I'm gonna spell it out for some people who don't know, who were impacted by the war on drugs. Poor white people, so white people are included, but they were of a different financial group. It wasn't those that are minimum wage. It was like they grew up in Black neighborhoods. They had, experience. Their parents had experience with that epidemic because of where they lived, not who they were. African Americans for who they were. It was specifically identified and directed to affect them. And then it trickled off and it affected a lot of other people. Like if you see the opioid fight now, like they really want to help the opioid crisis, right? Because it's affecting white children. It's affecting middle class, upper middle class, rich. They're overdosing and they're dying, and it's very unfortunate. But one of the things that we recognize as a culturally specific community is that they didn't do that when the crack epidemic came. They flooded our communities with the crack. The police didn't come and save us. Nobody came to save us. They didn't come and arrest the drug dealers. They deliberately let them sell crack cocaine in our neighborhoods without any type of justice done to help or educate us about what crack cocaine was. And then they sit back and they get angry because now they're looking at the after effects of how the African American community, we're all, I'm African American but also Native American. And I'm about to wrap it up. We're all collectively connected. So the African American community was targeted by the government and affected in a negative way, and that trickled out to every other culture. So those who were also impacted by the war on drugs were also indigenous people, and Mexican people, Spanish speaking people, people who were over here, poor whites. I'm talking about Russians, immigrants. that were already over here being affected with the Black community, but specifically it was targeted to the Black community. So yes, that is what we did, and I believe that we did an amazing job. It's not going to be seen on the largest level of, really, I think when Portland, Oregon, which is a very liberal white state, and I'm really proud to be, we got on the map when that stuff happened with George Floyd, like, for our allies, like, I'm really proud. But sometimes I don't think that they specifically understand that culturally we go through and experience things in a negative way that impact our mental health. It impacts our spiritual health, our physical health, and even with our activists in our community, they're being targeted and attacked. I know myself, Dharma, other people of the OAC Council were attacked. We received death threats because we were saying, um, we were drug addict. Well, I'm gonna speak specifically for myself on this topic. I was a drug addict. I am a drug addict. Crack cocaine, alcohol, marijuana. 15 years in prison. All that is like real, but I want to see things better for my community. And in order to work things better for my community, I have to have an input on how they address mental health and addiction issues in my community because they don't know. We for the longest time before Measure 110, we have been looking to doctors and attorneys and therapists who've never experienced addiction in their life tell us addicts what we need to get well and get healthy. Measure 110 gave us a freedom to come together and say, this is what we really need. So they may not see downtown ever cleaned up, right? Because the people downtown may not have been those impacted by the war on drugs because addiction is a widespread issue. Mental health is a widespread issue. Measure 110, you're talking about, I don't know, 300 million, $400 million. That's not enough to clean up a problem that has been ongoing for decades and generations, right? It's a small little tin in the bucket, but I think Measure 110 did make a great impact, specifically at the Miracles Club, Juntos, and other culturally specific organizations, which I'm sure Dharma will talk to the queer community, which I identify as well, but I can't speak for them. When you see me, you see a cisgendered female. Unless I tell you that I'm queer, bisexual, you would never know that. So I would never put myself out there. But being African American, being Black, growing up without nothing, on crack, when my mama was on heroin, my mama and my daddy died from the disease of addiction. I get so frustrated with people thinking that Measure 110 didn't do what it was supposed to do. Yeah, it did what it was supposed to do for those most impacted by the war on drugs. Miracles Club specifically, I was a senior director there. I wrote the grant. I did the grant paperwork for when we did the grant extensions, and I also sat on the OAC board. And when I had a conflict of interest for Miracles, I never read the grants. I never got to vote on it or anything like that. But for all other organizations, you talking about a kid that got their GED in 1992. That's when I got my GED, right? And these people asking me, to read these grants and to ask for my input. I'm going to go at it with everything I got because I know you already judging me because I already said identify as prostitute, a convict, crack addict, and all of that. And now you're asking me to do something for my community. I'm going to come at it with everything that I got. And that's what everybody on the OAC Council did. We came at it with our personal passion, our professional passion, and what we know. So what we know is we put the money where it was most needed to the most vulnerable populations. And a lot of people are going to judge by what they see going in downtown. We don't care about Portland building another Louis Vuitton store or another Forever 21. We don't care about that. We care about saving our community. So because you don't see it, look a little closer. Go to the culturally specific places that are in Portland, Oregon, and visit them and talk to those clients, talk to those mentors, talk to those executive directors. Go talk to Julia Mines at Miracles Club and ask her how that money changed our community because it did. But it doesn't matter when it's changing culturally specific community if it's not about getting money and if it's not about helping predominantly white communities sometimes. But that's what I have to say about that question. Sorry, I went over.
No, 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 no. There was no way I was going to interrupt you. Thank you so much, Onisha, for that powerful, powerful response. Thank you so much for uplifting the war on drugs that folks often forget about if they aren't aware. And also uplifting, that the purpose of ballot measure 110 was brought upon for greater greater issues other than downtown Portland and trying to revitalize downtown Portland, and also how all cultures were affected by the war on drugs, and that trickle down effect. And it just so happened, folks were able to come together, and I'm so glad that folks like you yourself were at the table, and everyone else that's here, that I'm eager to also hear from. So thank you, Onisha. Just want to say thank you. That's a really powerful way to get us kicked off. I'm going to transition us to our next question, which is for Dharma. Dharma is a interdisciplinary scholar, researcher, artist, cultural health advocate, and educator. She is pursuing her PhD in Women, Gender, and Sexuality Studies and Public Health from Oregon State University. Dharma serves as tri-chair for OHA Measure 110 Oversight and Accountability Council, is a member of the Oregon Department of Education's Recovery Schools Advisory Council, and is the president/grant and health program director of the Mid-Willamette Trans Support Network. Dharma's work draws from her lived experience as a first-generation biracial Punjabi American, disabled, queer, trans, intersex Muslim, and Pakistani third gender, and PWUD. Thank you for being here, Dharma. Again, your question is surrounding harm reduction. So just a little bit of background before we ask the question. Citing language from OHA, ballot measure 110's purpose was to make harm reduction, health screenings, as well as treatment and recovery services available to all who need and want access. In addition to adopting a health approach to drug use dependence by removing criminal penalties for low-level drug possession. As a researcher and harm reduction advocate, can you please speak to the impact of alternative treatments, as well as the significant role of harm reduction services play in preventing drug-related deaths and increasing access to healthcare, social services, and treatment?
Thanks, Sumiko, for having me, and thank you, Anisha, for getting us started off right. So those last few letters on my intro is that I'm a person who uses drugs. It's also in recovery, because I don't think that those things are mutually exclusive. As many of us know in the field of addiction science, right, that it's not just a binary of people who use drugs and people who don't use drugs, but that there's often there is a necessity rather of services that are alternative to this binary kind of thought that that the only people who deserve services are people who have a desire to discontinue their drug use, or have a desire to not just to modify their drug use, or maybe discontinue using certain substances. So harm reduction for me, for folks that are unfamiliar, harm reduction stems from, or it's kind of loosely defined as like a set of strategies used to reduce the risks associated or the negative impacts of drug use. I think, as a feminist and as a feminist scholar, I really take more of a wider approach to harm reduction and really look at it as a way that we can reduce the harms of all sorts of systems, including, the over-policing of our communities. As a transgender woman and as a trans woman of color, it's clear to me that these services that are designed in these in the recovery industrial complex are not designed for individuals like myself, and they never were. And so with that in mind, the role of harm reduction is really, one, it acknowledges that people are going to use drugs no matter what, right? Regardless of if we offer services or not, regardless of whether or not we lock people up, people are going to use drugs. That's the reality of it. And there's science behind, there's science and therapeutic options to help keep people alive and empower them with the tools that they need in order to make safer decisions about their body. So this includes things like syringe exchanges so that folks can use sterile injection equipment when or if they use IV drugs. It includes things like encouraging people to, or maybe like or giving people the knowledge that they need to understand that maybe smoking drugs is a lot safer than injecting drugs, right? Or that you should never share needles or syringes, rather, and because that might increase your risks of like bloodborne illnesses, for instance, right? These kinds of services are a crucial part of the spectrum of recovery services because the reality is that the majority of people who use drugs are not in recovery, right? And the majority of people who use drugs do not necessarily, they're not necessarily going to access treatment. And so what we need to do is to get people, to break down the stigma of drug use. And an essential part of that is harm reduction. Harm reduction looks at it's not a single organization or it's not even like one set of stable beliefs, but it's that kind of belief that, doing drugs is not safe necessarily, and we make it more dangerous through the criminalization of drugs, right? The reason that harm reduction exists is because of over policing. It's because the prohibitionist system is designed to make drug use more and more dangerous. And that danger is concentrated largely among communities of color and transgender people in Oregon, right? So, and indigenous folks. And so it's really difficult to approach something like harm reduction inside of the framework of Measure 110 because there's advocates that don't want harm reduction included because they view recovery as a binary. A lot of folks got their recovery from abstinence-based models, but not everyone operates that same way, right? So like when queer people and people of color are trying to engage with these normative kinds of drug services, think for instance about just like 12-step programs in the queer community, right? We're trying to integrate queer people who might have religious-based trauma to go into these definitely Christian and Western spiritually based programs and expecting them to just fit in, right? They might have gendered systems and, we actively discriminate against non-binary and intersex people in our recovery systems by having gendered based housing, for instance, where trans women, especially trans women of color, are often unable to access treatment because they're not able to be housed in a gender appropriate environment. And as we see across the United States right now, trans people are under attack, right? We're having our rights taken away left and right. And so it's, these increasing hostilities against us as people then make it even harder for us to engage with treatment, or abstinence-based treatment or the most rigid forms of treatment. But and the research really shows that harm reduction is an evidence-based approach to addiction science, right? There's a lot of proponents against that. As Anisha pointed out, when we advocated to not recriminalize drugs and to keep Measure 110 as it was intended to by the voters in the state, we had violent kind of pushback against us, right? Like people threatened to firebomb me, people threatened to kill me, and senators watched all that happen on their own Twitter feeds, right? They just watched these things happen because they were so dedicated on locking black and brown people up and locking trans folks up because they want to criminalize us, right? The number one thing about it too is money. They want to fuel the kinds of the private prison system, and they want to fuel the pockets of the police systems here and the criminal justice system, if you want to call it that, or justice system at all. That's where they want the money concentrated, and they don't want to kind of offer these kinds of alternative forms of treatment that really meet people where they're at. Harm reduction services play a huge role in preventing HIV and hepatitis outbreaks in our communities. They help reduce TB and other forms of skin kinds of conditions that come from injection drug use. They also keep things like syringes off the streets of Oregon by allowing us to have syringe exchanges. And harm reduction services also then get people to connect with health workers when they wouldn't otherwise connect with those people. And so, and as we're seeing drug-related deaths escalate all over the United States, all over the world, one of the only tools that we have to stop the overdose crisis and the drug poisoning crisis is harm reduction that can provide people with things like drug testing supplies and Narcan to reduce overdoses. Harm reduction includes so many things that keep people alive every day, but it's being increasingly, antagonized and not seen as like actual science, but it is. Yeah, and so I just really cannot underscore how important that harm reduction is to the spectrum of care that we provide for individuals in Measure 110. And really want to say, just as a researcher, too, that the strongest evidence in our system for changes in our system is to not criminalize drugs. It's to advocate for looser regulations on drugs, or looser regulation by police on drugs, because the thing is that the number one risk factor for overdose is interactions with police officers, and the state doubled down on that, unfortunately. And I think that it was a misguided attempt, because the research has not shown that Measure 110 increased uses of the use of drugs in our state. There was an ongoing opioid epidemic across the United States, across the globe, that was already happening, and it's being misapplied to Measure 110, so that racist county commissioners could give the police back the ability to search your car, right? So I think that it's really important that when we're talking about research and evidence, is that the evidence is that decriminalization works and that harm reduction saves lives. Thanks.
Thank you so much, Dharma. Again, another powerful response to our questions. I really, really appreciate you uplifting the services that harm reduction entail, and also highlighting that, not everyone is in recovery. And so again, highlighting the importance of harm reduction services. And then also you and Onisha both mentioned the threats on your lives just by doing this work, showing up for community members. And so I know we said thank you for being here, but thank you for being committed to community in a way, by showing up for the community for in the council, So I'm going to move us right along. And we do have a break plan. We have a 5-minute break planned. We just had shared a lot of information, heard a lot of information. So we have a 5-minute break. At OHEA, we like to call them screen breaks. And so we like to encourage folks to divert their eyes away from their screens for a few minutes. But please do whatever you need to do to take care of yourselves within the next 5 minutes. And we will return once the music stops. Please, for our attendees, if any questions have came up, you want to hear more about what has been shared so far, please utilize that Q&A box. Let's dive right back into our panel. I do apologize. We do have another panelist I forgot to introduce earlier. Melinda Bell is here. We're so grateful to have you here, Melinda. She is a certified alcohol and drug counselor who holds her CRM, PSS, PWS, and CADC. Melinda spent her adolescence and part of her childhood addicted to substances and in and out of jail. It wasn't until her 4th time within the judicial system that a federal judge, John Acosta, presented her with a new opportunity by sending her to treatment instead of extending her jail time. This period allowed her to reunite with her children and work towards breaking generational curses while building a better future for her family. Melinda's focus is now on helping others achieve their potential, a life that's worth living, free from substance abuse and domestic violence. Melinda joined Ballot Measure 110's OAC for knowledge of legislation and activities on a level where women of color may not have otherwise had a seat. Again, thank you so much for being here, Melinda. Melinda, your question is tailored towards behavioral health resource networks. Measure 110 redirected the majority of Oregon's cannabis tax revenue into funding addiction services. This included low barrier substance use disorder treatment, harm reduction and overdose prevention services, housing, recovery and peer support services, and employment supports. Measure 110 required that these services be available in every county in the state through at least one behavioral health resource network. Could you explain the role of the Oversight and Accountability Council in approving grants and funding for behavioral health resource networks? And how were organizations chosen to receive funding and which ones were given priority? pause for Melinda. Seems she may not have stepped back, and I apologize for not ensuring that she did before we got started. Melinda, are you there? We will, in the essence of time, we will come back to Melinda and move into Dr. Linda Ping's question. But allow me to introduce Dr. Melinda Ping first. Dr. Melinda Ping is a physician specializing in internal medicine and addiction medicine at, we're gonna pivot back to Melinda. Melinda, are you okay and ready to answer the question? We came back. And
Sure, I didn't know I was next. I thought I was last.
Oh, okay, no, I'm sorry.
But I'll go, sure.
I can, let me go ahead and read the question for you, okay?
Okay, thank you.
Measure 110 redirected the majority of Oregon's cannabis tax revenue into funding addiction services. This included low barrier substance use disorder treatment, harm reduction, and overdose prevention services, housing, recovery and peer support services, and employment supports. Measure 110 required that these services be available in every county throughout the state through at least one behavioral health resource network. Could you explain the role of the Oversight and Accountability Council in approving grants and funding for behavioral health resource networks? And how were organizations chosen to receive funding and which ones were given priority?
Okay. Hi, everybody. My name is Melinda Bell. Thank you, Onisha and Dharma, for explaining what we did on the Oversight and Accountability Council while we were there. I am no longer a member. I served, my term ended in January. Could you explain the role of the Oversight and Accountability Council in approving grants and the funding for the burns? So what I can remember, what we did was people would submit their applications through the grant process, and we would grade those grants, the OAC and OHA. Originally, it was only OAC grading the grants, and then due to time constraints, OHA stepped in and decided they would help us approve those grants and the funding for the grants. So collectively we had made subcommittees so that we could subcommittees to do the review panels so that we could get the grants out faster. And the subcommittees did like all the work, all the work behind the scene, grading the grants. But there was certain pieces that had to be in the grants, like they had to be culturally specific. They had to have peer support. They had to have housing. They had to have some kind of treatment element to them, whether it be clean and sober, harm reduction, or abstinence based. But all collectively, they all went into the burns. That is the Behavioral Health Resource Network. And through those burns, people can receive services that OAC provided through the grants. Organizations were chosen to receive the funding by which ones were given priority, culturally specific, and the ones that had already been previously granted grants were the ones that I believe received the priority funding. Culturally specific because, as Onisha stated in the beginning, this ballot measure was originally established for the people for the war on drugs. However, what we noticed while doing this is a lot of more people are utilizing this funding than what it was originally made for. With that being said, there's only so much revenue in tax marijuana that 400 million is not going to solve a drug problem in 4 years. And the second time around, we got less funding. I also wanted to keynote that all this happened during a pandemic. Okay. So nobody was supposed to be going outside. Nobody was supposed to be interacting with, life wasn't normal during the pandemic. I'll just say that. People were scared to go to grocery shopping. People were scared to go to the doctor, which also made mental health a crisis. So with that being said, all the organizations that we chose to receive the funding, we wanted the culturally specific, BIPOC, Indigenous, queer populations to definitely receive the funding that they needed to run their organizations or get an organization up and running. Some of those organizations that we gave funding to in the first round are just now going to be opening. There was some changes that were made where we didn't do capital funding, like building from the ground up, which I believe kind of hurt organizations that were wanting to start fresh and build, especially in the rural areas. I believe some of that funding should have went more towards assisting those folks in rural areas to gain the assistance that they need to spread across the burns. Like if you're in a rural area, say like Hermiston, your burn might be in not Milton Freewater, but Pendleton or Hepner, and there's not like an easy way without traveling to get to those drug and alcohol resources. So that's where the burns would have came in to assist people through those networks to receive the resources that they need in order to receive treatment or assistance through any of the burns. That's all.
Thank you, Melinda. Thank you for that insight. It was really, it's a great insight to see how OHA stepped in and allowed y'all to create subcommittees. And I really appreciate you highlighting that all the work that went into ballot measure 110 was being done at the beginning of the pandemic. And so thank you again for also highlighting mental health. All the while, I'm sure folks are still trying to take care of their own mental health, while being a service of community. And then I really do appreciate you highlighting how our rural communities are often left out too. So thank you. All right, we're going to transition over to access of services. And so this next question is for Dr. Linda Payne, who is a physician specializing in internal medicine and addiction medicine at OHSU and Hillsborough Medical Center. She leads the multidisciplinary and patient addiction consult team at Hillsborough Medical Center, providing comprehensive care for hospitalized patients with substance use disorders. Her research focuses on advancing evidence-based interventions to enhance addiction care systems, including the implementation of contingency management and the expansion of hospital addiction consult services. Through her work, she aims to bridge critical gaps in addiction treatment and improve care delivery for people with substance use disorders. Thank you so much for being here, Dr. Payne. So just some background before we ask your two-part question. Based on report, Measure 110 resulted in over $300 million in cannabis tax revenue to expand addiction services within its first 2 years alone, resulting in dramatic increases in the number of clients accessing services we've heard your fellow panel members speak to already, which include health needs screenings, comprehensive behavioral health needs assessment, substance use disorder treatment, peer support services, harm reduction, housing services, and supported employment. So the first question we have for you today is, given the work that you've done over a number of years, could you speak to the use of these services before ballot measure 110, as well as providing some insight of the increase of access after ballot measure 110's implementation? And their second question is, within the 4 years between ballot measure 110 and House Bill 4002, which treatment options were prioritized or preferred?
Thanks for the question, Sumiko. And thank you to Onisha, Dharma, and Melinda for their excellent answers to all those questions. I will do my best to answer this two-part question. So I think as a lot of people who work in substance use disorders or addiction know, um, treatment for addiction has historically been very, very difficult to access and continues to be pretty difficult to access. So the first part of the question, speaking to the use of these services before Measure 110, before Measure 110, SUD treatment and harm reduction services, housing services, supportive employment, a lot of these things on the list were all pretty difficult to access. I can think of a lot of patients who would come to me and just really had a difficult time accessing the supports they really needed. For example, someone might come and say, hey, I'm really ready to go to detox and I need a detox bed, but I wouldn't be able to get them in. And so they couldn't access what they needed. In 2020, Oregon actually ranked 47th out of 50 states in access to treatment. And 80% of those who were needing treatment or wanting treatment could not actually receive it. And this, survey was specifically asking about treatment, but I think for people who wanted harm reduction services or peer support services, it could also be quite difficult to access. So since Measure 110, there are people doing research on this specific question, so I can only provide insight based on, talking to patients and talking to other addiction organizations that I get to work with. But what I've seen is definitely an improvement in access to treatment, harm reduction services. A lot of all these services that you listed, my experience has been that there has been an improvement. As some of the other panelists said, marijuana tax dollars are not enough to completely fill the treatment gap. So it doesn't mean that all of a sudden everybody who needs any of these services are getting them. But my overall impression is that there seems to have been an improvement. I think Measure 110 really prioritized, and some of the other panelists spoke to this, really prioritized culturally specific services and harm reduction services. And I think that was really important because those are things that really are not well funded in our current healthcare system. And so, this past week I was at a peer organization in Medford, and one of the peers told me about just how helpful the Measure 110 funding has been and how they've been able to work with clients in accessing a lot more of these services, including housing services. And so I think it's been really important for people to be able to access more of the type of service they need. If someone wants to go to treatment, they should be able to go to treatment. If someone wants harm reduction services or peer support services, they should be able to find that. And I do think peer support services in our state have definitely expanded. I would say, when it comes to some of the other services, specifically substance use disorder treatment, I think most people, especially with more telehealth options, people are more able to access medications they need. I think where we continue to see gaps are when people are wanting to go to a detox bed or maybe a residential treatment bed. Those are just more limited in general. But Measure 110, in my experience, has definitely gotten a lot more culturally specific services out there, peer support services, harm reduction, and also some housing services and supported employment. So, yeah, I would say that I've seen a change. My patients have seen a change, and that's important to acknowledge.
Thank you so much, Dr. Ping, for your insight. I really do appreciate you providing context from your line of work specifically, as opposed to, some research, and also highlighting how difficult it was for folks to access treatment services. And that just speaks volumes of the work that the OAC has done in ballot measure 110, whether we are hearing that in the press or not. The folks that are doing the work directly with community members like yourselves are the ones that would know, right? So I just really appreciate your answer. Going to transition us to our final question we have for our panelists today, in which we will hear from Meredith Concepcion on prioritizing mental health services. Meredith has had a long career in mental health services as a licensed clinical social worker. She's an Army veteran who places a high value on her education, continuously furthering her knowledge and expertise to bring her patients the latest evidence-based practice necessary for healing. She has several years of experience working with all ages, cultural backgrounds, and struggles. Her expertise includes SAND trait therapy, cognitive behavioral therapy, dialectical behavioral therapy, prolonged exposure, EMDR, cognitive processing therapy, and solution-focused therapy. Meredith is also working on completing her credentials as a substance abuse therapist. Meredith served on the Oversight and Accountability Council until late 2024. Thank you for being here, Meredith. Again, your question is centered around prioritizing mental health services. So ballot measure 110 redirected cannabis tax revenue into a special fund called the Drug Treatment and Recovery Services Fund, which is used to fund mental health services. Can you share the types of mental health services covered and what they may include? Also, as a former member of the OAC, can you speak to how the OAC navigated ensuring mental health services were prioritized within the behavioral health resource networks, while knowing that defining rules, timeline, and funding structures came from OHA?
Hi, thank you, everybody. Hopefully you can hear me. I'm kind of a late bird to the game. I've only been here was OAC member for 15 months. So I kind of came in a lot after another social worker. Everybody had already, developed everything for the most part. And then I kind of came in late in the game to pick up the latter end until this January. So a lot of what I wanted to do, I wanted to just become, have a voice, because at the mental health level, just as an individual therapist or a mental health practice, I didn't really have much of a voice in the community. So I wanted to do something bigger. And so I saw this opportunity and jumped on board. And a lot of what I was trying to do was just be a voice for our community, especially here in like Central and Southern Oregon. There's not as many resources, and also on Eastern Oregon, there's not as many resources as there are in some of the bigger cities. So I just noticed that need is like really trying to get people to services and making sure that the services were well rounded and that they had all the, all of the components, like the behavioral health resource networks had the ability to provide that range of services for them, such as like individual group therapy, crisis response support, mental health support, culturally specific services, trauma-informed care, person-centered care, and that mental health wasn't just an add-on, that it was actually a center to the whole recovery model, the whole well-rounded for anybody can have access. Unfortunately, it's like I've seen working in my field a huge, there is a lot of bias and judgment toward people. And so sometimes a lot of people do not get the services they need just because of the way they look, the way that their insurance is a huge one, whether they're on drugs or whether, they've got mental health struggles, things like that. Like somebody who has schizophrenia or something like that, it's really hard for them to get the services they need because it's like they'll be judged. And so it's like trying to take out all that stigma and saying, okay, how do we have a voice and how do we look at programs to make sure that they are well-rounded and have all those services? So some of the things like first though, it's like we made sure that their mental health was not just an afterthought, but it was embedded in the very structure of services enabled for funding, defining mental health services, assessing the BRNs, providing a wide range of services, like I said. Second, my time on the council involved basically interviewing, reviewing funding proposals and presentations, and just making sure that mental health had a voice. So we did the presentations from providers across the state. Our role was to ask questions as a mental health provider or mental health services integrated into the model. Are licensed providers there? Are there services for individuals with co-occurring mental health struggles? Are there substance use, and the substance use disorder being addressed? Is there a proposal for trauma-informed care? If the proposal lacked mental health integration, we sort of flagged it so we can all discuss it. We had moments to discuss these things and decide what was, how we can ask more questions to make sure these services were being provided for people. Third, we placed emphasis on, again, that was already said very well with the other OAC members. Cultural services were provided. Grassroots organizations were, we placed emphasis on culturally specific providers and grassroots organizations with deep community ties. We prioritized those who could reach marginalized communities that have been historically excluded from traditional systems, such as we heard Black, Indigenous, and other communities of color, LGBTQIA2+ folks, homeless folks, and those in rural areas, especially rural. Oregon's pretty much rural. A lot of areas are rural, so it's like making sure that rural area had a voice. These groups face higher rates of both mental health and substance use challenges, but often encountered significant barriers to care. As a council member, we worked to uplift proposals that address these gaps. We worked really hard. I mean, most of the members before me really worked hard to make sure these gaps were provided and they were accessible and culturally relevant services. Like I said, I came on board afterwards and kind of, but I added my voice for sure. Finally, with the Oregon Health Authority, I managed the timelines, the rules, the structure, oversight. The OAC served as a critical role in holding the system accountable. It didn't just rubber stamp proposals like, okay, next. We evaluated them. We really looked deep. And when we saw gaps in the mental health services, we evaluated those concerns. Like, how can we bring these to our people and make this program better? I viewed my role as both a social worker and council member as one that brought real world practice and lived experience into the policymaking process. Although I joined late in the council later in the term, I made sure that mental health wasn't treated as an isolated service, but a central component of any meaningful recovery journey for people. Whether through funding decisions, ensuring provided accountability, or advocating for culturally responsive care, I work to keep mental health firmly on the agenda, asking questions and digging deeper. Hopefully I answered all those questions, but I think a lot of it was already covered. So I appreciate you. If not, you can ask at the end. I thank you so much for this opportunity to be here and share my experience, and I look forward to continuing to support OAC and Measure 110 and our community in the work that we do.
Thank you, Meredith. Thank you so much for the insight. So as everyone was speaking today, I'm just jotting down notes because it just helps me retain information. And there's so much amazing, powerful answers to the questions we had today. But as I was taking notes during your answer, I put in quotation marks something you had said, making sure that mental health isn't just an add-on, or making sure that mental health wasn't just an afterthought, as it is essential to the approach, right? And so I really just appreciate you saying that, because oftentimes folks, for whatever reason, may or may not feel that treatment services and mental health go hand in hand, but they do. And so I'm glad to learn and to hear how the OAC prioritize mental health. Before we transition to our Q&A, I just want to extend my gratitude. I'm smiling from ear to ear. I've learned so much within this past hour with you all. I know we have 20 minutes before we wrap up. So I do want to share some highlights and some themes that I've been taking note of as I've been listening from you all. Cultural specific providers. That is one of the highlights that everyone has spoken to at some point today. Highlighting rural communities and trying to ensure that rural communities are also getting access to services through this funding. Prioritizing mental health, meeting folks where they're at with harm reduction services. It's very, very, very powerful, and very grateful to learn about all the different avenues to that type of service. And then lastly, holding the systems accountable by addressing concerns. To me, I'm really glad to hear that the OAC had panel members and have panel members such as yourselves to be in the room to ask those questions of OHA and push back on things that don't feel right for our community. So I just wanted to say my piece about that. We're going to transition to our Q&A, and I'm going to pass it over to my colleague Pikake to read off some questions that we've gotten through today's event. I'm going to stop sharing my screen so folks can see the questions. Pikake?
Aloha kako. Hello, everybody. My name is Pikake, Hershey pronouns. And yeah, thank you, everybody. This is our second behavioral health event that OHEA has hosted, and I definitely learned a lot. And yeah, I really thank y'all for your shares. And I'm gonna paste a question in the chat and read it aloud. And this is for any panelist who wants to address it. So the question is, how would you encourage community members to join council or committees like this? And do you want to like speak to the benefits of being part of a council like the OAC? I'm especially curious about this as like a community member with my own lived experiences. I felt so energized. And yeah, like I really learned a lot more from y'all share than I have in previous events I've been a part of that has been talking about BM 110. So if any panelists would like to share, go ahead, Dharma.
Yeah, I think it really speaks to the fact that like community members, we are experts in our experiences, right? Like we live this shit every day. And so it's really difficult to get like these real world impacts of policy to be understood by these systems if we're not there, right? For many of us, like we're not given the opportunity to speak at a policy level like this. And so I just would encourage people to apply, like, right, like you'll have to, like, there's always different boards and things opening up. And once you get your foot in the door, you like have the ability to keep on going, right? You get more opportunities. And it is difficult, right? Because it is a racist and transphobic and ableist system that tries to deny us our access to these spaces. But like you have a right to be there, just as I have a right to be there, right? Any of us have the right to be there, especially if you have lived experience. Like you're as people who are consumers of services, they often talk about needing more people who are consuming services or getting services like clients. Like we need you there. And I think that it's like people just think that they don't have enough credentials or whatever, but like that's bullshit. Like you all have your lived experience, and that makes you an expert in what it means to survive these like systems of medical oppression that are all around us. So I would just encourage folks to just apply, like believe in yourself because we need you there.
Awesome. Mahalo, Dharma. Yeah, I really appreciate that response. Thinking about that point about thinking you don't have enough credentials or something like that. For me, I'm always so intimidated by all the like legal language and stuff. So yeah, thank you. Onisha, I see you mentioned in the chat. It's me, Onisha. Do you want to share about this?
Can you repeat the question? I got kicked out on my computer, so now I'm on my phone. Can you repeat the question? I didn't hear it.
Yeah. How would you encourage community members to join a council or a committee like this?
Well, the first thing I want to say is like it's very educational. find something that you're passionate about. Like we all have a lot of complaints about OHA and organizations like that, but one thing I can say about them is that they are informative. So if you sign up for on an email list, they will send you so many emails about different committees that you can get on, and there's usually a very simple application process. And don't be afraid. Like I've been to prison 3 times. I did 15 years in prison, struggle with crack cocaine addiction, all that stuff. And those are things they're like, yay, you're the perfect person we need to help influence how we want to make this care uh most authentic and most effective. And so what I have learned is if you fill out the application, and even if you misspell a word, or even if it's not exactly the way you think it should be, as long as you're authentic and are willing to take a call or a Zoom call and explain your position and why you want to be on the committee, you usually will be on the committee, because a lot of people don't have time to sit on these committees because they are very time consuming. um, and they are emotionally exhausting. Like I can't tell you how many times I went home crying, or I was crying because something happened in the meeting, or something happened at the tri-tier meeting that in triggered my trauma. So there is a trauma response. I'm not going to lie about that, especially if it's something you're really passionate about. And I'm really passionate about addiction and urban area treatment, especially for Black people, especially for African Americans. I feel like we are the only culture that has to really beg to have money, keep money, and explain why we need the money. And I feel like a lot of other cultures don't really have to explain that or make themselves relevant. Like, oh, we are Spanish speaking, so we need Spanish speakers. We're indigenous culture, we need people who are tribally enrolled to help govern our money. But Black people, it's like, we never got our 40 acres and a mule. You know what I'm saying? They value land. And being Afro-Indigenous, I say this with the utmost love, but I truly believe that I wish the government and I wish our community leaders would give the African American community what we've done for what indigenous people have done for their community. But I think we value land and money way more than we value Black bodies. But this country is built on Black bodies, baby. Our blood is under the railroad tracks. Our blood is in them fields. Our baby's blood, or our fathers, our grandfathers, and so it trickles down. And so, for whatever reason, we have highlighted a lot of different movements above the Black movement. So I'm always going to be there. It's not going to always be easy. Come in passionate. If you're a doctor and you believe in addiction medicine, come in passionate. If you're a white person and you believe in being an ally and that poor whites were affected, then you come in with that passion. If you're a trans person, if you, I do believe there needs to be more trans people. There really needs to be more trans people involved in care. I don't see enough of that. But what I would like to see, and what I think people will be motivated by, is more funding for this work. Nobody told me that I would have to use 2 weeks of vacation to evaluate 55 grants that were like 40 pages long. Like nobody told me that, right? Nobody told me that there would be days when I would have to read through 400 pages of documents before my next meeting, and while working full time and going to school full time, right? So I think asking questions, if you do want to plan for a committee, um our council, to make sure you ask the right questions. How many hours is this going to take? Can I do it? And do I have the wherewithal and bandwidth to do it with my kids and everything else? Because it is captivating, it is exciting, it is an educational opportunity, but it takes a lot of emotional bandwidth, and there has been some trauma, right? It's also trauma when you're arguing with other culturally specific people who don't see things from your lens, right? Which is specifically, as a queer person, why I don't speak on queer identities and queer needs. Like I speak up that they have effing right to use their voice, and whatever that looks like, we need to support them. But as a cisgender woman, even though I was married to a female for 13 years, it doesn't matter. I don't know what it's like to live the life of some people who are the most vulnerable in that community. So also being humble and humbling myself, even as an African American, I'm light skinned with straight hair, right? I don't know what it's like to navigate this country as an African American man who's dark skinned or African American woman who's dark skinned. I can't speak to that. So you stand in my place, remaining humble and being willing to work with people, and always to remember when you're applying for these council, remember unity does not equal uniformity. You don't have to agree with everybody, but you need to respect them and hopefully recognize that you guys are all working for the same goal, which is to improve our communities.
Mahalo, thank you for sharing all that. Yeah, that's really awesome insight. I really want these applications to like include all of that information. Like, we want you to apply for this. And if you're applying for this, here are all these things to consider. And I'm curious, before I ask if any panelists want to respond to this question as well. And let's keep this response succinct. Was this OAC thing, did you get money for being on the OAC? Or was this all volunteer time? I don't know if that's a question I'm not supposed to ask.
No, that's real, and I will answer it really quickly and leave room
Okay.
for Dharma and Melinda to speak on it. So we got paid a stipend. So if you worked, if you read through documents, if you sat on a committee or you sat on a subcommittee, like that, we had a media subcommittee, we had a different subcommittee that went over different grants in different counties. There was a few different of those. And then there was also the tri-chairs. So if you wanted to, and if you qualified under a certain income median, you could apply for the stipend, which is OHA offers, I think it's now $177 a day for whatever work. So whether that's 1 hour or whether you work 10 hours, you still get paid the same. And it is helpful. But it also is, you have to be responsible. You have to be responsible with submitting your invoices, and you also have to be responsible reporting to taxes, and you have to be responsible to fill out the following forms that you have to fill out to be certified to receive the funding. The invoicing in the beginning was very delayed. We didn't get paid for like the first 9 months of being on the council, but after they caught up, one thing I can say about OHA, they did pay us for those 9 months that they missed, a big lump sum, and then we were able to invoice monthly, and if we needed to, bi-weekly.
Good. Mahalo, thank you for sharing that. Dharma, I see your hand raised, and then Melinda, I know you also unmuted to respond. Melinda, I'll pass it to you first since you unmuted initially.
I was just gonna say, yeah, that so in the beginning we started off with the $30 stipend, which wasn't much, and then I believe it went up to I'm not sure what the number was, but it started at 30 and it ended at 177 or 178. Which was also helpful for us taking time out of our jobs, our lives to compensate us for that. In the beginning, they were only paying us the $30, and then something happened behind the scenes to where they decided they were going to give us what they were paying the legislators a day. And so we were able to get the same amount of money as they were getting when they do legislative work.
Good. How about respect community? Like,
yeah. So I mean, that was huge when we went from $30. We're like, we're doing all this for $30,
yeah,
and it was a lot.
Like I would expect,
$30 a
like, give me
day.
the real money though. $30, that's for my meal, right? Like,
Yeah.
okay. Thank you for sharing
So
that.
yeah, thank you.
And then Dharma, before I pass it to you, I just want to check in with Dr. Ping and Meredith. I haven't forgotten about y'all. So I'll check in with you too after Dharma's share. Go ahead, Dharma.
I want to make sure that folks realize that like this isn't like a huge money making thing for a lot of us because we're in it for the passion. As far as our council, because I know that it gets misrepresented a lot, right? Like people in the Senate were like accusing me of like just wanting to make money, like this is my job. But like this isn't, we're not being paid to be there just to be there, right? Like it's just a mandated thing, right? So we're not making like huge amounts of money. We have to pay taxes on all of that money too. So it's like, it's not necessarily a huge money maker, right? That people make it out to be. Not saying that my fellow counselors were saying that, but like people in the community often make it out to be like, y'all are making money, this is your job, blah, blah, blah. But it's not like that. It's just the standard rate that anyone who's doing services for the state would get. And so it's there. It's not enough either though, because this is taxing work, right? Like it's really costs a lot on your body and your psyche to keep up with that. So I just want to put that out.
Yeah, mahalo. Thank you for pointing that out. Yeah, with everything Onisha was sharing, it sounds 100% like very taxing work. I'm like, it should also be paid in a way that, wow, it is quite a lot of labor. So Dr. Ping, would you have anything you wanted to share?
Yeah, I just wanted to add to what people were saying that I was surprised by what an enormous amount of work it was. And there is an income threshold. And so, I'm lucky, I'm a physician. I don't necessarily need the additional money, but for people who have a full-time job, it's kind of just relying on a lot of labor and volunteer labor that really is not, I think, adequately compensated by $177 a day. And then when you join the council, you're not told like how many hours exactly everything is going to take. And so for people who maybe need to plan around full-time jobs or reduce their hours in other things, like it's not easy to do that. So um, I would just say like, I don't think that most of the council members were really compensated like appropriately for the amount of work that people are doing.
Mahalo. Thank you for sharing your perspective as a physician and being on the council. A lot of this money talk also feels relevant to that question of like encouraging community members to join. It's like giving them all this information about what it could look like and things like that feels really important.
Can I
And then
say one more thing? Can I say one more thing? And it's gonna be quick. Yeah, it's gonna be really quick. So listen, the number one reason why I advocate and I hope that they continue to up the income for these people is because they're taking their ideals and they're developing program that they're getting millions of dollars for, and people and therapists and doctors and everybody is getting receiving income in these communities, but these councils can sometimes drain you spiritually, especially if you experience addiction, you're currently experiencing addiction, domestic violence, and all the things that go along with being in active addiction and being impacted by racism and homophobia. And then you're asking to develop programs, and they're really taking your ideals and they're putting into legislators, they're making laws and they're making money off of your ideals. So the fact that people feel a little shy about asking for money, I just hope they get rid of that ideal. They continue to ask for money because your ideals are super important and it's the meat and potatoes of these programs that they're creating from your ideals.
that is so right. Mahalo for sharing that. And then Meredith, I'll pass it over to you for any closing thoughts that you want to share about this.
Yeah, I was just gonna say I know that I'm a little displaced more in central Oregon, but it does matter, and it is hard to set that time aside because the time was lots of times like, oh hey, we just changed it from this week to this week, and it's like I have a full-time job, so really trying to juggle that time was really challenging at times. So it's like I had to juggle a lot of my other schedule, so it was a lot of stress trying to figure out and get things going and make sure you're give it. And well, for me, it usually happened during lunch. So it's like I give up a lot of my lunches just to be there. So, I learned a lot. It was great. I felt like I had a bigger, more well rounded perspective of all the services in our communities and also how to help patients and people, from all the way down to the bottom, all the way to the top. It's like, how can we help navigate this process? Because the underlying thing is for them to get that care, and that little bit of the amount of money or no money, the volunteering it's worth it because we're making a huge impact. And we're all coming together from all of our experiences, our trauma, our inequalities, all those things, cultural differences were all coming together. And I think that was the beauty of the OAC, is like they picked all of us specifically in different roles, so that we could speak on mental health, so we could speak on harm reduction, so we could speak on, cultural difference, those things. It's like, I think they strategically did that, which was nice. So we all had that well-rounded voice, to come together. It was nice. I really enjoyed it.
Awesome. Mahalo. Thank you for that. Yeah, I'm just noticing Daisy in the chat shared, thank you all for being here. I know this was also an ask, but we are so happy you were able to join us and share your experiences. I echo that same sentiment. I'm really grateful for y'all very personally as well as like professionally. Like I said, I learned a lot. And I appreciate y'all. I'll pass it over to Sumiko for closing thoughts.
Thank you, Pikake, for leading us through that Q&A. Thank you again for all of our panel members for being with us today. I've learned so much. I'm so, so grateful for all of your wisdom and insight and labor that went into not only just planning for today, but also just over the past 2 years of your time being on the council. So again, thank you. For our attendees, I'm going to go ahead and drop a link to our feedback form. We'd love to hear feedback on how today's event went. And yes, of course, thank you, Daisy, for that note. And thank you again as well to the interpreters and our captioners for today's event. Gonna go ahead and wrap up again with thank yous. And this event is being recorded, and so we will upload it to our YouTube page. I will be sharing a link with you all just in case you all want to share it out with your community members as well. I will be in touch soon about follow-up and next steps. But again, thank you so much. Oh, and Dharma, thank you so much for dropping your email in the chat. I'm gonna copy it and save it so that way if any community members reach out and want your contact information, I can share that. And if any panel members want to share their contact information or want me to share it with community members, please let me know and I'm happy to do so. But I know it's 32 after the hour. Again, thank y'all for your time. I will be in touch about follow-up. But thank you again for informing us. I've learned so much. I can't stop smiling. I'm so grateful. So thanks again, y'all.
Thank you, Sumiko. And it's okay to share my info.
Okay, gotcha. Thanks, Onisha.
The same.
Here to share mine as well.
Okay,
Have a great
awesome.
day, everyone.